Good day, I am Jasmine with Daniel from BS12G, and for today's video, I will be performing the immediate newborn care return demonstration. So the immediate newborn care is the care given to the neonate after birth. So all newborns require essential newborn care to minimize the risk of illness and maximize their growth and development. So I have already performed hand washing and prepared the materials that I will be needing in this video. So of course, the infant's clothes, which includes the bonnets, the t-shirt, the booties, and the mittens, and my working gloves, kidney basin, the medicines that will be given in the infant, which is the vitamin K and the erythromycin, the thermometer, surgical gloves, the cotton soaked with cleansing solution, the gauze pad, and then the umbilical clip and the cutting scissors. So now I'll properly identify the infant through a name tag or risk tag, and also enhance the infant's comfort by keeping the environment warm, because newborns are risk for hyperthermia. So now I have to put on my working gloves. So now I am going to proceed in weighing the infant. And also I have already weighed this clamp earlier, so I will just deduct its weight on the overall weight of the baby. So the normal weight of the infant is 2.5 to 3.7 kilogram. Now for the cord dressing, put on sterile gloves and properly restrain the upper and lower extremities of the newborn. Using a cotton ball soaked with alcohol, disinfect the cord 3 times from the base upward. Next, place a sterile gauze pad at the base of the cord and clamp cord with an umbilical clip 1/2 inch from the base of the cord. Now, cut the cord about 0.5 centimeter above the cord clip and express the remaining blood from the cord with the gauze pad placed on the base of the cord. Place a gauze pad again at the base of the cord stump and pour 70% of alcohol over the cord. Now I am going to proceed with injecting vitamin K into the infant. So newborns are not born with enough of vitamin of this vitamin, which is needed for blood to clot normally. So babies who don't get vitamin K at birth are at risk for potential fatal bleeding disorders. So now we draw the exact amount of vitamin K from the ampule. Now inject into the middle third lateral aspect of the infant side. Now I will get the anthropometric measurements of the infant, starting with the head circumference. So that's 47 centimeters. And then for the chest circumference, 43 centimeters. And then for the abdominal circumference, 48. And then for the length of the newborn, 36. So I'm now going to take the newborn's temperature rectally to check for the initial core body temperature. So for the initial butt, hold the newborn in a football grip manner, folding both ears. Now carefully wash the head with the use of baby soap or mild shampoo. Now I have to remove my wet gloves. And now I have to wear another set of sterile gloves. So now thoroughly dry the baby and put on the newborn's diaper. And then I have to put the mittens. And then the hoodies. So now I have to wrap the baby securely with a clean blanket. So now I have to place the newborn in the crib with a drop light on and attaches the crib tag. So for the application of the crib's prophylaxis, shade the newborn's eyes from the light and open one eye at a time by exerting gentle pressure on the upper and lower lids. Now apply ophthalmic ointment from the inner and outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So for the application of the creed's prophylaxis, shade the newborn's eyes from the light and open one eye at a time by exerting gentle pressure on the upper and lower lids. Now apply ophthalmic ointment from the inner to the outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So now I will take the newborn's vital signs. Now that I am done with the procedure, I will now do the aftercare of the materials I have used. So now record the procedure done with other pertinent information.